I am here today because OEB offers you a benefit called long-term care insurance. During the next few minutes, I'll show you why most people need this coverage and how they use it. We'll look at specific features of this plan and why today's tough time makes this benefit more important than ever. Let's start with a little bit more information about the plan. Some people are confused by the term long-term care. This is the type of care you would need if you cannot perform what's known as the activities of daily living. This care can be received at home, in an assisted living facility, or in a nursing home. And one important thing to remember is that long-term care is not always for the elderly. These can also happen during our working years due to an accident or serious illness, such as Alzheimer's. Here are the levels of care that are covered under this plan. Home care is an essential part of the coverage. We know that most, if not all of us, would prefer to stay in our home to receive the care we need. The most common types of home care are custodial, intermediate, or skilled nursing. And Unum's plan can cover all of those needs. Total choice home care, available for an additional premium, is considered the richest home care level benefit because it gives you the most freedom when it comes to choosing a care provider. Under this option, your benefits would cover professional home care services, as well as allow a family member to provide you care. Here's an idea of how expensive this kind of care can be. You may be thinking, well, my health insurance could cover some of that, so I just have a copay. But it's very important to understand why that's not usually the case. Many people think they have a plan to pay for this care, and they really don't. Here's why. Even a modest amount of long-term care insurance can have a significant impact for home health care. Major medical insurance typically doesn't pay anything for long-term care. It can help pay for time in a hospital, but not in a nursing home or assisted living facility. Your plan also includes an inflation option that allows the pool of benefit dollars to increase by 5% of the original amount each policy anniversary for the life of the plan. As an example illustrated here, a $108,000 pool of benefit would double in just 20 years and would continue to increase each year after that by 5%. The best part is there's no maximum cap on this inflation benefit. LTC Connect provides toll-free telephone access to information and support for caregivers. The trained specialist will help provide objective information and help explore your options. There is no charge for this confidential service, and you may use it as often as you'd like. Here is where you can go to apply for coverage. And you may be asking yourself, why buy now? Well, the younger you are when you sign up, the lower the premium. Your premiums will stay level year to year, and your plan has the continuation of coverage, which means if you ever leave OEB for any reason, you can take this coverage with you. This concludes our presentation. Thank you so much for your time.